asked some parents once, it was really interesting what their biggest worries were. And they said that when you first have a child with epilepsy, it's always about the seizures. Your first concern is these horrible, life-threatening events. And then after a couple of years, it all turns to other things. Education, so school, a lot of discussion about what's the right school for my child that has Dravet syndrome, what's the kind of right format for them, is it better that they start in mainstream and we see how they get on, what sort of level of support, thinking about an educational healthcare plan, how does that happen? And then sort of thinking about social relationships, you know, how do I support my young person to make friends or to have friends if they're not very good at making friends or they have difficulties with making friends? And then kind of behavioural challenges, you know, if my child is starting, as they're developing, starting to present with sort of self-directed behaviour or very strong challenging behaviours, how do I then best manage those? Who's going to help me? And I think that's what happens as a child with Dravet grows. It's about those allied professionals, physiotherapists, occupational therapists, speech therapists, psychologists, and sort of specialist Dravet professions, so like Gait Clinic and the specialist Dravet Clinic, that kind of stuff. So it becomes more than just about the health condition. It then becomes a lot more about education and socialising and psychological support.